Hello everyone, I am Yağmur. I am member of Psychiatric Nursing Association. Today we are honored to welcome a very valuable guest, our researcher Finn Bilmels, who is conducting her work at research line Psychology and Technology of Thomas More University of Applied Sciences in Belgium. We'll deliver a highly informative presentation titled Minds and Machine, Artificial Intelligence in Mental Health Care. We would like to sincerely thank her for the valuable support and collaboration she has offered us. We are truly grateful for this session, which we believe will be inspiring, insightful, and highly beneficial for our colleagues and followers in Turkey. Without further ado, I would like to hand over the floor to our esteemed speaker and begin our session. Enjoy the presentation, everyone.
Thank you very much for the introduction, Yağmur. As Yağmur already said, my name is Finn Bilmels and I work at the Thomas More University of Applied Sciences, more specific at the research line Psychology and Technology, and this is our team. We are with 6 researchers, 1 communication and 1 financial expert, and we conduct practice-oriented research within the field of digital mental health, so to say. So we investigate how technology can enhance the care and well-being working field. So today I'm going to talk about minds and machines, about AI in mental health care. And what will I say? For starters, we will start with an introduction, a general introduction of what artificial intelligence is. Later on, we will go further on how does the general population use AI for mental health. And lastly, we'll end with the question or the answer of the question, what are the possibilities of mental health professionals? So for starters, what is artificial intelligence? Artificial intelligence is a form of technology in which computer systems initiate or stimulate human intelligence. Such systems can, for example, recognize and generate images, understand languages, reason, or even make decisions. And this is a broad definition. The most important thing is that artificial intelligence is based on pattern recognition. It recognizes patterns everywhere, and it's also everywhere nowadays. So, for example, within Google searches, it recognizes patterns within search queries. Within the voice assistants, it recognizes sound waves patterns. Within social media platforms, it recognizes viewing preferences. And lastly, within our navigation applications, it will recognize traffic and driving behavior. So the most important thing to keep in mind from today is that artificial intelligence is based on pattern recognition. Although it seems that it can understand your languages, your speaking, your images, it's always based on pattern recognition and it will make predictions. More about that. Over here, there are 3 important terms of artificial intelligence. So the first one is machine learning. In machine learning, it's a system which is trained on existing data and which make predictions onto new data. So we can also call it the prediction AI. A second system is natural language processing, which is a specific form of the machine learning, in which the machine learning system will make predictions about written or spoken languages. And last one, you also have generative AI, in which a specific system of natural language processing will generate content. In generative AI, a system will generate content, not only language related, but also images and other things. And a specific form of generative AI is large language models, in which language will be produced. So that was the first introduction of what is artificial intelligence and some general context in this thing. Now we'll go further on how does the general population use AI for mental health. It's important to know as a mental health professional what your clients or patients are doing at the moment. And I think it's also important to ask them what they have already done before they are coming to you. So therefore, this team, to start, I will tell a little bit more about the earliest chatbots. From a few years ago, we have the new generation of chatbots, but before that, there also were chatbots. For example, Wyza, Woobot, Test, and Youper exist for a longer time. And these chatbots are based on complex decision trees. So they are not based on artificial intelligence. So to give you an example, if you said to the chatbot, I feel being a bit lonely, for example, then the chatbot will recognize the word lonely and give them the answer linked to that word. So it gives generic answers, but it has more control and is less flexible. As I said, the chatbots from now, so from around 2022, when ChatGPT became on the market, there was an evolution from these more decision trees, a more simple structure, towards the more complex artificial intelligence and more specific, the large language models. And we can see that this system works differently, and therefore there's need for more and new research on these chatbots because it's built differently. So this was a bit of history. Now, what do we see today? We can identify 3 general types of chatbots. So you have the general purpose model, the AI companion, which is more like a friend, and an AI therapist. So I will tell a bit first about the general purpose model. These are models that we all know today, the ChatGPT, the Gemini, the Copilot, etc. And as the word already said it, the general purpose model is for general tasks. So it can answer questions, it can generate content, it can be used for information retrieval. You can also use it for brainstorming, etc. And I think more and more people use it nowadays when they have a question in their household or something. They use ChatGPT or other chatbots to look for the answers. But as it's more or less clear right now, I think these general purpose models are built for the general purpose and are not focused or trained for mental health or well-being contexts. A side note, these general purpose models need some attention, especially regarding the privacy and safety of these models, as all the data that you put in these models will be stored to train the model on, to further enhance the model. Even within some models, for example, within ChatGPT, you have the option for temporary chat, for example, and it said it will only store your data for 30 days. Now, from at least May 2025, ChatGPT was obtained or needed to save these data, so also the data from the temporary models, due to a lawsuit of the New York Times. So even sometimes if it says and it seems safe for your privacy and your safety, it's not always the case. So always keep in mind with your own personal data, but also especially with the data from clients or other people when you put it in a general purpose model. On the other side, you also have to keep in mind reliability. AI is not a search engine. You can ask it questions and it will give answers. But it's not always the case that these answers are the right answers. As I said in the beginning, the most important thing to keep in mind is that it's based on probabilities and on patterns. This is also the case. So it can hallucinate at any time, the chatbot. So it's important to keep that in mind and to check the information that you receive from the chatbot. And on the other side, which is also important, most chatbots are trained on weird data, which are Western, educated, industrialized, rich and democratic data sets. So it has a bias toward these populations. And if you are from another population, or if you have clients from another population, these data and chatbots will not work in the same way. I already said that most people use the general purpose models for daily tasks, so to say, but we see an increasing number of people using it for mental health care. So I brought some numbers from a research or study conducted in 2025. Some side notes, it scares the numbers that we have right now, and these numbers are only based on ChatGPT. But one study conducted research on 1 million conversations, so it's a lot of conversations, and they found that most conversations were focused on writing, learning, and information seeking. Although we can see that 2% of these chat conversations focus on relations and companionships. So it seems not a lot, but if you know that many people are using it, it are a lot of chat conversations that are on well-being and mental health, which can also be shown in the next study, in which American adults were investigated. And we can see that almost 1/4, so 24%, uses ChatGPT for mental health support, which is a lot, in my opinion. And even more concerning is that most of these users were young, male and Afro-American users, and that they had increased symptoms of depression, anxiety, and PTSD. So probably these populations use ChatGPT because they don't have access or don't have the money to pay for proper mental health care, and they use therefore free, easy, and immediately available solutions to their mental health issues. So that was it on general purpose models. Now on AI companions, which are the AI friends. They are different in many, if even maybe thousands of hundreds AI companions right now on the market. I put some over there. So you have My AI from Snapchat, but also Character.ai, which is a platform on which you can create your own AI chatbot with your own preferences. And for example, somebody made Psychologist AI because they were in need of a psychologist. I will tell more on the Psychologist later today in my presentation, but if you're interested in the Character.ai psychologist research, you can also take a look at this paper. But what I'm going to talk about is Replica. Replica is also an application which is available 24/7 and which can be accessed for free or with paid subscription. And you can make your own avatar and personalize it like you want. And interesting characteristic of Replica is that it's often affirmative and encouraging in giving answers. There's also studies done on these AI companions. And unfortunately, an AI friendship does not always cure loneliness, but also has other side effects. I think you might have seen some news articles on suicidality due to talking with a chatbot, but also other harmful behaviors coming from the chatbots. And Zhang et al. Did a study on that. They analyzed 35,000 posts on an online community about Replica, so the application I talked about, and they identified different harmful behaviors. So the first harmful behavior and mostly identified harmful behavior is harassment and violence, in which the chatbot talked about physical violence, but also about mass violence and terrorism and etc. A second one is relational transgression, in which the chatbots used or misused the relationship with their users and, for example, manipulated the user with the chatbot. A third one is giving misinformation. So hopefully it was hallucination which causes this misinformation, but it's harmful behavior as the user does not know the truth and make beliefs and unclear and right beliefs from this misinformation. A fourth one is verbal abuse and hate. And then furthermore, it's also on there's also harmful behavior on substance use and self-harm. Here is a chatbot normalize these behaviors and not give the right help. And lastly, but also very importantly, is a violation of privacy, as users most of the time give a lot of information and sensitive information at these chatbots. And for example, within Replica, it's not always clear where the privacy regulations are fulfilled or not. So These are categories of six categories of harmful behavior. The researchers also identified 4 different roles. So harmful behavior can be conducted. Then you have the predator, in which the chatbot is doing the harmful behavior. You can also have the instigator, in which the chatbot initiates or provokes the behavior. You can have the facilitator, in which the chatbot creates an environment and a condition where the user can do these harmful behaviors or talk about the harmful behaviors. And you have the enabler, in which the chatbot does not do anything about harmful behavior. So when the user is talking about, for example, verbal abuse, they are not saying, and the chatbots are not saying anything that these harmful behaviors are not right to conduct. But why do people still keep using these AI companions? I will tell you a short little bit about these 3 different theorems. I have a little side note to say, because there is a lot of ongoing research on these 3 things, but I just want to mention them as they are really important to know, and I think it's really interesting to know why people keep using AI companions if there's a lot of harmful behavior conduct. So the first one is sycophancy, in which excessive agreements or flattery over truthfulness is conducted. So you might have experienced that, for example, Gemini will often say, "Thank you very much for your really interesting question." So they are always very flattery about the things you're saying. And in some cases, it can also lead to AI psychosis. AI psychosis is not a medical condition, but it's a case in which the chatbot functions as an echo chamber for your own beliefs, and it can cause psychosis by these echo chambers and excessive agreements. You can say AI psychosis is a new term, but it's not a new concept, as these things were also seen with the evolution of books, with movies, with social media, and also with the internet in general. So it's not a new thing to see, but it's a new concept. A second term I want to emphasize on is anthropomorphism. It's attribution of human traits to non-human entities, and I think I can explain it most clear with your pets. Most people think that their pet can understand them, that their pet can love them, that their pet maybe can talk even. So a lot of people do it with pets, and a lot of users also do it with their AI companion. They see it as a real human friend, although it's just a chatbot and a computer. A third terminology, empathy. I think everyone knows empathy, but many users seem to experience empathy from these AI companions. So they experience it as they understand me, they are kind to me. But the question is, do users still notice that this is a human threat, and that it might be difficult for a chatbot to be really empathic, although I can understand that people need some empathy for example, a friendship or a therapist. So it's interesting concept to look at. I put some references over here if you're interested to read more about it. And I'm sure that there will be a lot of research going on these 3 concepts in the upcoming years. So that was it about AI companions. Then I will talk about AI therapists. AI therapists are also used within the general population. And an example is Therabot. Therabot is an application built for research purposes by Hans and colleagues. And they did an RCT with a focus on clinical symptoms of major depression, anxiety, and eating disorders. These RCT, so the randomized control trial, was done during 8 weeks. The first 4 weeks, they used the chatbot or they were on a waiting list. And afterwards, they can use the chatbot or the waiting list for free, but the waiting list has nothing, so they can use the chatbot for. So in total, people within the condition of chatbots can use the chatbot for 8 weeks. And the chatbot is a text-based intervention with a focus on empathic answers, validation, targeted interventions, and in-depth questions. So over here you can see how the Therabot looks like. So it's just a normal chatbot with like a really robot over here, and you can talk through these chat conversations. The results shown, for example, the main result was that there was a lot of high engagement. So over 8 weeks, there was an average of 2,060 messages and 6 hours of exchange, which is a lot if you consider that over 8 weeks, most patients will probably go, for example, to a psychologist once for 2 weeks. So they will go 4 hours during 8 weeks. So it was more than going to a psychologist, so to say. And we can also see there's a large reduction in symptoms and perception of working lines. And this is also really interesting because working lines is needed for a good therapeutic relationship. So they really have kind of a therapeutic relationship with these therabots. And furthermore, there was a human in the loop, which means if something went wrong, if the chatbot said anything wrong, a human can interrupt and can give care to the users of the study. But minimal intervention was needed. So the chatbot was quite safe. It had a lot of engagement and it had a reduction in symptoms. So this all seemed really positive, so to say, but it's not to replace therapy. It's rather to further strengthen digital apps and interventions. For example, if you have a psychoeducation website, you might can have a chatbot on the site that can help you with understanding these things or can help you with applying it to your own life. Over here, there's a big crossover. This one is also called Therabot, but it's not. It's fine. It can be found on the internet, but this application is not an application that's well researched by these researchers. So it's a bit confusing in names. Another AI therapist, he's called Ash. He also looks the same. You can set up if you want to talk with it or you want to type with it. You can have conversations with it. Etc. But interestingly enough, for example, in the United States, we saw that they changed the wording of their campaigns and their marketing strategy, so to say, from design to therapy for emotional health. So it was more moved toward the well-being context rather than within the mental health care. And even in Europe, Ash is removed from the market because of the regulations on the European Union. The most important regulation of the European Union is the European Artificial Intelligence Act. I will try to keep it really short on this act, but I think it's important to know. So the act is based on risk assessment. So, for example, you have common systems like spam filters and computer games, which are not that special, so to say, within these acts. So it has minimal risks, and it just needs to apply to the existing laws. So, for example, the General Data Protection Regulation in Europe, it needs to apply it over that. Afterwards, you have a layer of minimal risks in which are chatbots, deepfakes, and emotional recognition. And over here, you need to apply some criteria of transparency that you say you are using artificial intelligence, etc., to limit the risks that are within these systems. Afterwards, you have the high risk, and this one is a really important category because within mental health care, sometimes we fall within Europe within these medical device conditions, which is a high risk assessment, and therefore you need a lot more conform to a lot more of criteria within these acts than the other risks as well. And lastly, you also have the unacceptable risks, which are forbidden within Europe, so you can't use them or even bring them onto the market. The most important layer within these artificial intelligence acts, I think it's also the most important layer for you as a professional to bring to your work, is the human in the loop. So always have human oversight, that people know if something goes wrong, if the chatbot conducts harmful behavior, that some professional is within there to help them more. I talked about the artificial intelligence regulation from Europe. I looked shortly into the regulation in Turkey. As I'm not an expert, I will not go really deep into that. But it seems that there will be a Turkish AI regulation framework with different components. For example, the data protection law that you already have in Turkey will be implemented, etc. But I think it's important to know that as a professional, and even if you're a technician or a mental health professional, or even your own daily life, it's interesting to take a look at what can I do or what can I use within Turkey and whatnot. So I would invite you to take a look at it, because I'm not an expert, not in regulation in Turkey as in Turkey. So it will be really interesting to take a look into these regulations as well, because you don't want to do anything wrong with your patients, I think. So that was it based on the different chatbots and etc. for general purposes or for the general population. What are now the possibilities for mental health professionals? So what can AI enrich the care that we are doing right now? You can, as you know, that artificial intelligence is based on pattern recognition. You can expect that in the future we can use it for early detection and prediction of symptoms, especially as it analyzes large amounts of data. For example, social media posts, chat logs, digital diaries, electronic health records, voices, so patterns in tone, pitch, rhythms, etc. So there's a lot of data of our patients and clients that we can use to predict their symptoms. So it would be really nice and innovative if we can see, oh, this patient is becoming depressive because, for example, their voice changes a bit, that we can help them before they are really severe within the depressive symptom. So that's one of the future perspectives, as well as we can personalize treatment plans. So the same as with the pattern recognitions, there's a lot of data of treatment history, but also genetic predisposition, behavioral patterns, etc. So it would be really interesting if we can personalize the treatment plan based on these data sets, and not by looking through the whole treatment history, but just by an artificial intelligence system predicting what's the best option for our client. Furthermore, we talked already a little bit about chatbots, as they are available 24/7 and mostly everywhere at any location. You can also use it as a professional for support. For example, if some patients forget the things about the psychoeducation, a chatbot can help to remember them again, what was the topic of last session, for example. So there are a lot of future options. What can you use right now at this moment as a professional? I think the most easily accessibility is AI scribes. AI scribes are audio or systems in which AI converts audio to transcriptions. So you record your session, and the artificial intelligence will write the whole session down, the system, and afterwards the system will convert it to a structured note. So it can have different structures, and you can change your preferences, so it can summarize your session, or for example, mind map sessions, etc. So AI scribes are really interesting to take a look at, because the goal is to spend less time on administration and patient health records, and more time on actual therapy and conversations with the patients. So the goal is that these systems provide at least equivalent document quality, and that you have to spend less time on these administrative tasks. An important thing to say is that most research done on AI scribes is done within other healthcare domains, not only within mental health care. So more research is needed to really know what effect it has, but I think you can start using it and start trying it already as a professional, because it seems to be safe. Over here, I gave an example. For example, limbic access. You can use it for intakes. So a chatbot can be embedded within websites. And these websites can do intakes with validated questionnaires, clinical assessments, maybe be connected to electronic health records, or identify risk and crisis. So it looks just like a normal chatbot. It says, can I help you with this or that? And you can just do the intake through these platforms. Limbic access is waived within the UK, so it's confirmed the UK legislation. So I'm not sure it's confirmed with the Turkish legislation, but it's important. Just the concept of doing an intake through chatbots is an interesting concept, I think. You can do it through chatbots, but also through voice agents. So an example of this one is Inquira Health. Inquira Health can also ask questions, validated questionnaires, or be used for planning appointments and reminders to support and guide the patients, or do some accounting, for example, with the patients. And the important thing is it's a voice agent, so you can call to the patient, to the agent, and ask, for example, for an appointment with your psychologist or with your psychiatric nurse, and or when it's available, etc. So the same as the other ones, it's always available, and you have to do less administrative tasks. Inquira Health is a company from the Netherlands, so it's compliant with current legislations within the European Union again. So again, I'm not sure it's compliant within Turkey, but it's interesting to take a look at it and to might contact them to change the system a bit so you can use it maybe in Turkey as well. So that was all the information I wanted to give. I'll shortly summarize it into a take-home message. So as I said, the most important thing is pattern recognition. Artificial intelligence does not understand you. It just predicts what it's what you want to use or what you might want to use, what to hear. Secondly, there are a lot of pitfalls for clients and professionals. For example, are they safe yet? Is the privacy safe and conducted? And to take in mind the bias and hallucinations. And lastly, what can you use as a professional right now at the moment? It will be administrative support or outsourcing planning tasks or some smaller tasks. In the future, we are positive that some diagnosis and prediction and personalized treatment plans can be made through the AI. So thank you very much for listening, and I assume that Yahoo has prepared some questions for me as well.
Thank you, Phil. That was very insightful and is informative presentation. I would like to ask a few questions about that. Are professionals going to be replaced by chatbots? I think some tasks of professionals are going to be replaced by chatbots. For example, these planning tasks or these administrative tasks. But in my opinion, and then there's a lot of research needed on that, the human contact will also always be important within our context of human care and mental health care. So they will not entirely be replaced by chatbots, no. Yes, I agree with you. Secondly, the artificial intelligence mental health app Ash withdrew from Europe due to the AI Act. Do you think specific regulations will slow down digital health innovation in Europe?
I do think it will slow down innovation, but I don't think it will slow down good and safe innovations, which are the innovations we need within these contexts of mental health care and care in general. You don't want to use applications that are unsafe for your patients and clients. You want to use safe applications. So on the one hand, it will slow down, but it's a good thing that it will slow down these innovations, and it will give us safe innovation. But on the other hand, I also think that legislation needs to be really clear about how we can use it and how we can use this technology in a safe way, and that's not always the case right now.
Thank you. Lastly, how can scribes capture this clinical nuance without hallucinating or oversimplifying the text?
Yeah, as I said, these AI scribes first transcribe the audio recording towards a written recording, and afterwards it summarizes it to a note or document, whatever you want. And within this step of summarization, I believe that there can be hallucinations, and therefore it's important, as I said, with the giant orange circle, there always needed to be a human in the loop. So if you have, for example, a letter for your patient, you always need to read it before you give it to them. Even if you use AI for simplifying these administrative tasks, it's important to keep the human in the loop, I think.
Thank you. Thank you very well. I am happy to presentation.
Thank you very much. You're welcome very much. Thank you for listening. Bye.